the rotator cuff tendonitis. Very popular, isn't it?
Very, very popular. It tends to happen for the most part on the younger age population. It can still be seen on in the elderly population in occasions, because the rotator cuff tendons, they tend to degenerate as we age. So most of the time, a lot of people, they think it's an inflammatory process, and actually it turns out not to be an inflammatory process. It's more of a degeneration of the tendons as we age. So the tendons, it can either be a little more thicker, and the space where they're running through, they narrow that space, and that can cause some of the symptoms. Or sometimes the tendons themselves, they can tear, and they can cause some of the symptomatology. And
since you mentioned symptoms, let's look at some of those symptoms that somebody could be feeling associated with rotator cuff tendonitis. Pain in shoulder.
Pain in shoulder. So, normally, if you have an increased activity when you're all of a sudden you start like swimming, and you start getting some of the symptoms. Normally you have decreased ability of moving the shoulder, like reaching cabinets. It's really painful because you're overusing those muscles. And normally the shoulder weakness, a lot of people, they might experience those symptoms. The reason is that you tend not to use the shoulder, and that can lead you into having some deconditioning of the muscles.
And doctor, I want you to go to our biodigital right now, if you don't mind, and we can actually show our viewers the shoulder. And maybe you can explain to us, doctor, so eloquently, as you always do, the anatomy of the shoulder and what's going on.
All right, so this is the shoulder joint here. We're looking from the side view here. So we have in here we have the cervical spine. In this region here, then we have the clavicle, which is what people call the collarbone, and then we have the shoulder joint here. So basically, the shoulder joint is a joint like any other joint, is a junction between two bones. And normally, there's a lot of movement. It's a ball and socket type of joint. So there's a lot of movement. So that's what it tends to get injured so easier as compared to some of the joints that we have. Normally, there's a four tendons that they're coming, and they do stabilize the shoulder. Those are what we call the rotator cuff tendons, and normally they can be prone into getting injured as we age or we overuse them.